Linda Way with Western Center on Law and Poverty. First of all, I would like to thank the department for engaging stakeholders in this process. However, we also share some of the concerns of the advocate community related to the comprehensive diagnostic evaluation, as well as the development of a transition plan. We'd also like to raise an additional concern related to the low number of children actually receiving this service, that it's less than 900, and our estimates had placed it at much higher rates, as well as the department's original estimate, and so that's of a concern to us.
Madam Chair and members and distinguished staff, Rick Rollins on behalf of ARCA, the Association of Regional Center Agencies. First of all, I want to thank Senator Mitchell and Senator Monning for their longstanding support of our community, and particularly on this issue. We've learned a lot from SB 946 and the implementation. We did some things that were good, some things that needed improvement on, but we've learned from it, and we're totally committed to continue to work with the advocacy community, the department, and DDS, and we would encourage you to continue your oversight of this issue until we're all satisfied that this transition has gone smoothly and every child who needs this service receives it. Thank you.
Thank you, Madam Chair. I had permission, I think, to speak on behalf of a family who couldn't be here. My name is Kathleen Smith, and that's actually the family's real name. They couldn't be here because right now they are deeply involved in a very, very extreme crisis with their child. She has autism. She is not a regional center client yet. She is applying for that, and she is falling through the cracks of even this new benefit. This new benefit is for behavioral health treatment, primarily ABA type services. She is in a mental health crisis, but she has autism. She's gone to the county. Well, there is an exclusion for autism in the county mental health. She cannot get anything for her daughter through county mental health because of the autism exclusion for county mental health, specialty mental health services. She's gone to the health plan. The health plan says we only provide mild and moderate treatment. Severe treatment, you have to go to county mental health. She is in a complete do loop. Senator Monning, she's actually in your district. She's in Aptos. We have engagement with, at my level, Senator De Leon's office has gotten involved in trying to actually get this child treatment. As she said, my daughter has been 5150'd, which is the 72-hour psych hold, 6 times since December. They're not giving her any treatment. She's in and out and in and out. She said today, why can't they just put me to sleep like a sick dog? It's sort of bone chilling. I can't even say it without having my entire body just, so as much, the behavioral health benefit is incredible, but there are severe mental health issues that are still outside, falling through the cracks, required under EPSDT. This child needs our help to come up with, where does a child with severe mental health issues and autism go in a crisis and post-crisis? Please help this mom. Thank you.
I didn't know it was carved out of county mental health. That's curious.
Thank you. Melissa Cortez-Roth on behalf of Autism Speaks and the Center for Autism-Related Disorders. First, I have to say how wonderful it is to be here supporting the implementation process and not here asking for coverage. We spent a battery died. So we do want to thank the department for their open process. We would ask that the committee monitor the transition process. You've already heard the comments regarding the transition that we saw with Healthy Families. We don't want to see a situation reminiscent of that. And I'd also like to comment on the rates being established. I know that there were some recommendations that it may be overestimated at the budget right now, but until we know exactly what those rates are going to be, we don't want to see a reduction in that budget. We want to make sure that the rates are sustainable. The regional center rates currently are not, so we want to make sure that it is a sustainable rate. And to the comments from Western Center, those numbers are low. We're not sure why we're not seeing more people enrolled in the process, so that could be something that this committee looks into as well, to make sure that there's proper outreach from the department, so that people are aware of this new benefit. Thank you.
Now I'm my third person, and that's my last person.
Don't believe her.
Good afternoon. My name is Gloria Press-Stewart. My son Aiden is 15 years old and was diagnosed with severe autism at age 4, and we have spent the last decade working to give him functional life. It took me over 6 months to get him to wave goodbye. Although he's almost 16, he doesn't speak in functional sentences, and I've never had a real conversation with him. He has meltdowns that are caused by common environmental noises such as dogs barking, birds chirping, and babies crying. He wears the sound reduction headphones and he's prone to meltdowns. Now that he's 5'8" and 160 pounds, he's also bigger and taller than I. I don't go in public alone with him because of the meltdowns, and when they happen, it's difficult to manage. We have the police called by people who think we are kidnapping him when he runs away when startled, or by people who think he is being abused because of the way he screams when he hears a sound that hurts his ears. We use ABA services over the past few years. Even with the hormone changes of puberty, the frequency and duration of his aggressive behavior has decreased. There are still many challenges, but ABA has created a much improved quality of life for Aiden and is helping him prepare for the future. For instance, he now uses techniques to self-calm while in public instead of knocking down a shelf in a store because a sound startles him. We have private insurance, but Aiden also qualifies through Medi-Cal. ABA is very expensive. The regional center stopped covering our copays, and now we owe $3,000 in bills for ABA copays. By the end of the year, the total will approach $10,000. I'm in school now after deferring my education for about 12 years due to Aiden's needs and cannot afford this. I've received conflicting messages about whether I'm going to get paid. At this point, my only choice may be to drop my son from our primary insurance and just move to straight Medi-Cal so he gets the ABA he needs without any copays. I'm trying to do what's right. That seems wrong to me as a parent and a taxpayer. I want to do my part, yet my only choice to continue ABA services are to shift the entire burden of his health care to the state of California. Gloria Press-Stewart.
Thank you.
Fada Al-Maliti, parent. Mr. Monning, my son Mohammed says hi. You've had multiple pictures with him. And our picture on Facebook, 174 likes. Thank you very much. Anyways, so I'm coming here to talk about what I see some parents seeing barriers as implementation. So for example, for a parent who has private health insurance and then has Medi-Cal as a secondary insurance, it's great because we got all of autism in the managed care plan. So they're going to go, the managed care plan is going to find them provider and they're going to go to that provider. Awesome. Now, because when they have private insurance, they have a copay. So let's just say that copay is $10. And let's say the managed care provider is Kaiser. So Kaiser is going to pay the ABA agency, whatever the rate is, less than $10. So Medi-Cal, because it's a secondary and they have it as an entitlement, they are supposed to pick up the $10 copay because it's also less than, it's not above what Medi-Cal is saying they're going to pay for the service. But the issue is that the ABA providers are not Medi-Cal providers. So they can't take the $10 from the family. And so we were on a call today, and from what I understand from DHCS, they said that the provider could just send in the bill, but to where they send in the bill, there are Medi-Cal billing requirements. Medi-Cal pays 6 months in arrears. You know, Medi-Cal is a beast of its own. And it's one thing, and you know, providers have their business and they calculate their business every month by getting paid at a certain time. So dealing with insurance is kind of bad enough. You know, you get 30, 60 days, but dealing with Medi-Cal in 6 months, it's simply not sustainable for providers. So I would like to see some further clarification on who and how this copayment is going to be paid. Thank you.
Members of the public who came and provided us with critical, experience-based information on how this benefit's going to be operationalized. So we're going to roll back to the department to walk through the questions that are listed.
Sure. So sorry, 52? I answered 2 of 4 and didn't turn the page. So I apologize. I was excited to be at the last item. So, I mean, I think you've heard a lot of the same issues being raised, you know, from the way that we are implementing this benefit. We view the comprehensive diagnostic evaluation as the D in EPSDT, and so that is the diagnosis that is first required to then provide the services that are necessary to ameliorate the condition. And so certainly we appreciate the concerns that are being raised, and we're certainly happy to keep having conversations about making sure that kids are getting the services they need, but they do need to have the diagnosis, and that is the process that we have. In terms of the wait list, I think, my team has been working with folks, and we certainly, what we'll need, we're not hearing that in the Medi-Cal delivery system. I think there could be wait lists that are outside of the Medi-Cal program providing the services. If there are Medi-Cal issues, we haven't seen them yet. And so certainly if there are specific examples that can be provided to us, we would be able to look at that. But we do monitor it with our health plans pretty closely.
I was going to say, how would you have seen them? Through communication with the health plans? How would you know?
Through the health plans, or if individuals were reaching out specifically, sharing specific examples of either themselves or individuals who are having challenges. What we're tracking is that it's taking somewhere between 4 to 6 weeks to receive the CDE, but we want to make sure folks are getting what they need, and so we're happy to continue to work with the many stakeholders here who have been very invaluable in getting this program up and running. And certainly with respect to the numbers of kids, as I mentioned, a 30% increase in the last month. We do believe that this will continue to ramp up as individuals better understand the benefits available to them. And so we don't believe that this is the level it will be at eventually, but that we're still seeing sort of the first 6 months of the implementation happening.
Okay. No, I did it. Yeah. I pretended you were here. Yes. I pretended you were here. Okay, thank you. They didn't hear that. Right, I knew you were. I channeled you. Thank you very much. Thanks again to the members of the public for the conversation. Moving on to item 13, 1991 realignment technical trainer bill language. Page 53 on the agenda. That's how I know I'm getting old, because I was here in the 1991 realignment. Woo.
Hi.
Hi.
Lee Scott, Department of Finance. I'm going to give a brief overview of the proposal.
Thank you.
The proposed language would eliminate the need to redirect sales and use tax and vehicle license fee revenues between the health and social services subaccounts. Additionally, the proposed language would make necessary technical and clarifying changes related to AB 85 from 2013. AB 85 modified the local revenue fund distributions to capture and redirect county savings resulting from the implementation of federal health care reform that began January 1 of 2014. AB 85 established the Family Support Subaccount, which receives sales tax revenues that are redirected from the health subaccount. That redirection is then distributed to counties for the CalWorks program. While this redirection mechanism frees general fund resources to pay for medical costs, the process to swap the funding between the health and the social services subaccounts is significantly burdensome for the State Controller's Office and the Department of Finance. By eliminating the swap, we'll significantly reduce workload and improve administrative efficiencies while having no impact to the funding available to the subaccounts within the 91 realignment. Additionally, the technical changes will eliminate or modify provisions that are no longer applicable and conform the language to current practice. We note the administration worked extensively with the stakeholders in drafting the language before you. And if you have any questions, I'm happy to answer.
Senator Monning? Any comment, LAO? Any public comment? Yes, 2 minutes, please.
Thank you, Madam Chair and members. My name is Farah McDade-Tink for the California State Association of Counties. I'm also representing the County Welfare Directors Association and the County Health Executives Association of California, the county affiliates that worked with the Department of Finance. We believe this bill does increase the transparency. To say that the swap was burdensome is an understatement. We appreciate the collaboration and we support the trailer bill. Thank you.
Thank you very much, Senator Monning. I'll entertain a motion to adopt the placeholder trailer bill language. Thank you so much. Thank you very much. Well, that ends Part A of today's agenda. Thank you. We will make our transition of staff and mindset to now Part B of the agenda. where we'll be hearing from two state agencies, the Department of Social Services, thank you, and the Department of Aging. There are several votes that we'll be taking today on Part B of the agenda as well. Senator Monty. Thank you. All right. I don't see how many calories it is. You know, I'm counting. It's Thursday. Thank you. We'll go ahead and get started with Department of Social Services on BCP number 9, CCI, extension of limited term positions.
Thank you, Madam Chair. I'm Eileen Carroll, Deputy Director at the California Department of Social Services for Adult Programs. Yes, the department is asking for a 2-year extension on the 9 positions, the limited term positions that we received. There's 2 managers, there's research assistants, and then there's generalist analyst positions that are in the 9. These positions are needed to address the increased ongoing workload associated with the transition of IHSS program into managed care, including the fiscal and policy functions, social worker training, provider training, contract management and monitoring, oversight functions, and the administrative operational aspects with establishing the statewide authority as well. If CCI, in response to question number 2, if CCI is deemed inoperable, the time frame and process for dismantling the CCI are currently unknown. However, these positions will be needed to ensure the workload associated with that is fully covered. The department will fully utilize the positions until they expire June 30th, 2017.
LAO, any comments?
Yes, good afternoon, Madam Chair and Senator Monning. Mark Newton with the LAO. We've reviewed this budget request and we concur with the staff recommendation to approve it. We feel it's justified on a workload basis.
Thank you. Finance? Public comment.
Madam Chair, Senator Monning, Gary Passmore with the Congress of California Seniors. As I said earlier in some testimony, we are strong supporters of the CCI, and we are strong supporters of this budget request from the Department of Social Services.
Thank you very much. And with that, Senator Monning, I would entertain a motion to accept the bill. Plain language. Thank you very much. Thank you. Moving on to item 4170, the Department of Aging. We've got an overview of the department, and then we'll move into 2 oversight issues. Oversight of expanding capacity to service persons with dementia and managed care plans grant, and the model approaches to statewide legal assistance systems phase grant 2. By show of hands, are there members of the public who intend to provide public comment on either of these items? I was going to consolidate. Okay, I just see one hand. Okay, let's go ahead and get started with the overview. Thank you.
Thank you. Good afternoon, Madam Chair and Senator Monning. Laura Conley, Director of the California Department of Aging. I will be brief in my overview because I know we have spent much time together in many hearings providing an update and an overview of our department, and conscious of the time today. The California Department of Aging administers community-based programs that serve older adults, adults with disabilities, and family caregivers, and residents in long-term care facilities throughout the state. The department is the federally designated state unit on aging and administers funds allocated under the Federal Older Americans Act, the Older Californians Act, and through the Medi-Cal program. CDA has a proposed 2014-15 budget of $194.5 million, with $30.5 million of that in general funds and 115 positions that are all here in Sacramento. CDA contracts with a statewide network of 33 area agencies on aging, which directly manage federal and state-funded services to help older adults find employment, support older adults and individuals with disabilities to live as independently as possible in the community, promote healthy aging and community involvement, and assist family members in their caregiving roles. CDA also contracts directly with agencies that operate the Multipurpose Senior Services Program, MSSP, through the Medi-Cal Home and Community-Based Waiver for the Elderly, and we certify CBAS centers for Medi-Cal participation. The funding chart on page 4 shows CDA's funding history for the last 5 years, starting in fiscal year 2010 and 11 to the budget year by funding source. I'd just like to call out a few of the issues that are summarized in the overview in that section. While it was a small piece and it only shows up kind of as a blip in terms of that funding chart, sequestration definitely had an effect, particularly in federal fiscal years 2013 and to a certain extent ongoing. CDA lost approximately $9.8 million in federal funding in federal fiscal year 2013 as a result of federal sequestration. The nutrition sequestration, which was the largest portion of that hit during that year, was partially offset with funds from the Assembly Speaker's Office in fiscal year 13-14 and 14-15. And in 2014, at the federal level, Congress moved to protect nutrition funds from the sequestration cuts. But those cuts have continued on in terms of the supportive services, preventive health, family caregiver, ombudsman, and elder abuse prevention areas. Given the extraordinary fiscal situation the state has experienced over the past number of years, there have been significant reductions to many of the department's programs, some of which had been entirely general fund supported, and the chart on the top of page 6 lays out the general fund reductions back to state fiscal year 2008 and 2009. To continue to pursue innovative strategies for moving forward as we have an increasing aging population to better serve them and persons with disabilities and to promote their independence and quality of life, CDA has been very proactive in securing federal demonstration grants and other funding sources to move us forward in that direction. And several of our spring finance letters are tied to these grants and special funds, and 3 of them that you'd asked us just to kind of give you a summary on our demonstration grants that are already underway. Should I pause here to ask if you have any questions before we move to reviewing them? Okay, great. The first is the Chronic Disease Self-Management Education Grant. That's a 3-year grant that we have had from the Administration for Community Living. We were awarded $1.5 million over 3 years to implement this program. The chronic disease self-management and the diabetes self-management programs are evidence-based programs developed at Stanford University that are 6-week workshops, really focused on helping individuals with chronic health conditions to better understand and manage their own conditions and make behavioral changes to really achieve that. We have been implementing this grant actually over a number of series of grants and have counties that have received funding through our grant to implement, including Los Angeles, Orange, Napa, Solano, San Diego, and San Francisco, but then a number of other counties are participating with us as well as our health plans and health systems. So we have a wide coalition of organizations that are involved in this process, and through our grant, we're able to provide technical assistance to many of them in implementing the program. Although the grant doesn't end for another 6 months, California has met and exceeded its performance goals with 7,600 workshop completers to date. Actually, I think to date we're closer to 9,000. Just getting the latest, there's always a lag in terms of the data reporting, and we lead the country in terms of the 21 states that have this funding in meeting and surpassing our objectives. So we are very excited about that. One of our goals in this program is really expanding access to these programs to underserved communities, and we're very pleased to say that it's being offered in various parts in the state in 11 different languages, which is extraordinary. Moving on to serving individuals with dementia, if you would like. We also have received a demonstration grant from the Administration for Community Living for $820,000, again, over a 3-year time period, with the focusing on the Coordinated Care Initiative, particularly the CalMedi Connect plans, and providing additional resources to the care managers in those plans to better be able to identify and serve individuals and families who either have diagnosed or may be in need of a diagnosis of Alzheimer's or dementia. We are implementing this grant in partnership with the Alzheimer's Association chapters. They are actually doing the training and provide the match to the grant. We provide the oversight and coordination for the grant, and Department of Healthcare Services and Department of Developmental Services is actively involved with us in the steering committee for this grant. To date, in Northern and Southern California, 143 care managers participating in CalMedi Connect care managers have gone through the training in 5 of the health plans, and a second level of training is under development and will be offered this summer that's really focused on providing additional expertise within the health plans through a dementia care specialist within the plans, and that will be undertaken this summer. In addition to the training that the care managers go through, they then have 6 months of follow-up case consultation, monthly consultation calls, where they can call in and get guidance and support and kind of do case conferencing about more challenging and technically difficult situations that they're facing to, continue that training and ability to get additional resources in their work. Thus far, in terms of the care managers who've been through that initial training, we've gotten very positive feedback from them. The only negative was they were 8-hour trainings, and they would have liked to have seen that broken up. I think we all understand that when we go through training situations like that. For the health plans, though, that was really, they required that it be within that 8-hour time period. But they said in terms of outcomes, they have been much more diligent as a result of the training in terms of identifying family caregivers in their case records and in working with the family caregivers, as well as making referrals to the Alzheimer's Association and other home and community-based programs after having gone through that training. So very positive results thus far. And then the third demonstration grant that we're giving an update on is the statewide legal assistance systems grant. This is the phase 2 of this program. I didn't include this as one of our major Older Americans Act programs, but it is. It's a required service for legal services for older adults. Back in 2009, we received our first demonstration grant from the Administration for Community Living to focus on this. There are so many areas where older adults and persons with disability need legal assistance. The funding, of course, is nowhere near the amount of need. So really in both of these grants, the focus has been on how to prioritize really what are the most crucial areas that this funding should be targeted toward. Doesn't mean that it can't be used in other areas or for other particular needs that area agencies and legal service providers might have. But just in terms of kind of planning and focus areas, that certainly was an area. And prior to the first grant that we had no standardized data collection mechanism for what kinds of services were being offered. So that first grant provided input and a structure to how we collected data from the legal services providers on what in fact they were doing and characteristics of their clients. At this next phase in terms of the grant that we have now, which is really focused on going kind of the next step, we are looking at promising practices, what's working, what might need to be tweaked in terms of those priorities, and then looking to expand resources. And we've noted here, I think, a couple, expansion of the lawhelpca.website and IUTA Legal California organizations online assistance to help seniors and legal advocates in both English and Spanish. various other great things. Also looking at, we've been doing a survey on the capacity of Older Americans Act legal programs to provide their services, and developing recommendations in terms of priority issues, including those specifically related to elder abuse, neglect, and financial exploitation. The legal services providers are also to assist the ombudsman program, so looking at how that's working and best practices and suggestions there. And I think I'll just pause it at that unless you have questions. Moving on.
Stop there before we move into the BCPs. LAO, any comment on the service to persons with dementia or legal services? Finance? Public comment on these two items, the oversight model on legal services or service to persons with dementia? Whoops. Slow down.
So I'm Debbie Toth, Part B. So I just wanted to, first of all, say that working with the Department of Aging as an oversight body in our adult day healthcare programs and our multipurpose senior services program is a breath of fresh air compared to working with other oversight agencies. And they are an organized, compassionate, educated group of professionals who have been providers and understand what it is to be on the ground floor providing. So I just want to put that out there, and also to say that they turned around that $800 and some odd thousand grant in a matter of months working with the Alzheimer's Association. And I don't know if there's that kind of support in other states, but I just wanted to commend our Department of Aging for the work that they've done on that. As a member of the Alzheimer's Disease and Related Disorders Advisory Committee, I saw firsthand how quickly this turnaround was, and it was just incredibly impressive, and I just wanted to say that.
Thank you very much. We'll take compliments, won't we?
I know, exactly.
Sometimes they are few and far between. All right, let's move into item 4.
Thank you.
The April letter. Why don't we do items 4, 5, and 6, BCPs 1, 3, and 4. We'll hold public comment until we got into the last BCP. Fair enough?
Great.
Okay.
Thank you.
Medicare Improvements for Patients and Providers Act 2014, and this is another grant.
Yes. Let me begin with our role in MIPA, because MIPA actually at the federal level is a huge funding source. CDA has received 3 MIPA, Medicare Improvement for Patients and Providers Act grants in prior years, and the goal in terms of our program is focused on helping low-income Medicare beneficiaries learn about and apply for low-income subsidy or Medicare savings plans, with a particular focus on helping them be able to afford and enroll in Medicare Part D, the prescription drug benefit within Medicare. As required, this funding comes to us in 3 buckets, so to speak. One portion of it goes to area agencies on aging. Another portion goes to the health insurance counseling and advocacy programs, HICAP, and then a third to aging and disability resource centers where they exist in the state. So it gets allocated out that way. During our 2013 MIPA grant, about 2 million Medicare beneficiaries were reached during that one-year project, and that generated about 5,300 low-income subsidies, Medicare special need plan applications. I wish I could remember offhand, but I think for each one of those beneficiaries, that usually equates to about $2,300 worth of benefits they previously didn't have. Very important in terms of their drug benefit. The new and the focus of these grants is always hard to reach populations. This new 3-year MIPA grant we've received will be awarded 1 year at a time from the federal government. For the first year, CDA was awarded $915,145, and we anticipate receiving about an equivalent amount over the remaining fiscal years for a total of $2.9 million over the project period. And this request is really kind of in 2 parts. One is requesting that $2.9 million in budget authority, and the second component of that is requesting provisional budget language to allow carryover of any unspent funds from one year to the other so that we can maximize and use every single penny of those federal dollars over the total grant period.
Okay, let's go on to the second item.
Sure. The second item is this is the
BCP number 3.
Number 3, Aging and Disability Resource Connection budget change proposal. And the request is for an extension of this program and the 2.5-year limited term positions that are at CDA to manage this program. And we use our existing federal funding from our department to help support this, as well as funding from Department of Healthcare Services and the State Independent Living Council to braid our funding, is how I like to refer to it, to continue on this program. The focus of this program is really intended at the federal level and certainly as envisioned at the state level here to be a highly visible and trusted resource in the community where people can turn for information on the full range of long-term services and support options that are available, and a coordination point in accessing these services and planning ahead for long-term services and support needs. I think this was really in a response to many people not knowing, many individuals not knowing where to turn when their families had these types of needs, and sometimes all they knew about was to call who advertised, which really doesn't help people look at the full range of options that might be available to them. So at the state level, we have a coordination and oversight and technical assistance role that our department has been performing since it transitioned over from agency last year to the Department of Aging. There are currently 6 ADRC partnerships serving 6 counties: Alameda, Nevada, Orange, Riverside, San Diego, and San Francisco. A 7th area serving the kind of next up northern counties of Butte, Colusa, Glenn, Plumas, and Tehama counties is pending redesignation. They had been ADRC, and we've put everyone through a redesignation process to make sure they were still kind of doing the work of an ADRC, and we have some materials still pending from them. There was initially federal funding to get these projects started, starting back in 2004. The state has had a series of those grants. The funding at the federal level has diminished over time, but we really see the benefit of continuing this and braiding our funding to continue to support these efforts. And even in spite of the lack of new demonstration funding coming forward, there are various areas, various counties that are working on developing their ADRC. So I think it really points to the fact that this is a vision, that's a program that's needed, and a collaboration between the Aging Network and the Independent Living Centers is really our focus in bringing those resources and programs together to be collaborating and supporting meeting the needs of the public in this area. And so our request is for an extension of the program and the 2.5 limited term positions. Organizationally, we are reestablishing an ADRC committee at the state level that will include participants both from representative area agencies on aging and independent living centers, as well as the State Independent Living Council, the State Department of Veterans Affairs, CalVet, excuse me, updated term, and Department of Healthcare Services, so that we are really coordinating our work together and the opportunities available to us to work together in moving this program forward. Any questions?
Number 4, the supplemental nutrition assistance.
Yes.
The program expansion for the education program.
Yes. This is a request for expenditure authority to continue this program. We are in the process of implementing this and have begun the program. It's a partnership, certainly, that was years in the making between Department of Social Services and ourselves in order to focus on older adults who are low income and help to bring good nutrition education to them, as well as programs to help support their physical activity through the CalFresh education funding that Department of Social Services receives from the federal government. Our request is for expenditure authority of $3.7 million in reimbursement funds that would be used over the next 4 state fiscal years. This is a 100% federally funded program and requires no state contribution or match. And we also request an extension of the 2 limited term positions for those 4 years in our department to provide oversight and technical assistance to the local area agencies who are implementing this program, as well as to work with Department of Social Services in meeting the requirements, the federal requirements of the grant.